Hi, I'm Kath Sykes. I'm one of 4 implementation managers working for the Applied Research Collaboration in Kent, Surrey and Sussex, and I support the Living Well with Dementia core theme. I'm here today to talk to you about top tips for implementation in health and social care research. So just a reminder of what applied research means. This is research that responds to and meets the needs of local populations and local health and care systems. And it's characterised by building on the findings of basic research, generating a solution to the specific problem to be solved, and then applying that solution. And this is important because too much health and social care research does not reach or benefit the system or the people it was designed to help. This could be because it didn't ask the right question, or because it wasn't a priority for the health and care system, because it took too long, because it was never designed to be usable or implementable in the first place, because the findings are not accessible to or reaching the right stakeholders, possibly because the recommendations cost too much, and also if it doesn't align to current delivery models or would require significant organisational change, that would be a barrier too. So my top tips for implementation are to align to NHS and care priorities. And this means engaging widely, remembering that not every trust, every service or location will have the same priorities or deliver care in the same way. So check your assumptions, test your research ideas in more than one environment, with more than one person and more than one team. Involve the public, community and experts by experience. So this can be generic engagement, but sometimes it will need to be expert by experience, people who've got current specific insights in order to develop those meaningful questions and insights. And can you co-produce outputs? This really helps make them accessible. Know your target audience. Are they clinicians, commissioners, carers, voluntary sector, local authorities, budget holders, public, digital teams, someone else, or all of the above? Engage with your target audience, which will be much wider than your research participants and your research collaborators, and socialise the study before, during, and when you have the results. Embed and share rapid insights. Share your findings early. For example, socialise evidence synthesis, build the story, the needs, the gaps, why this research is so important and relevant. And this keeps your target audience interested, excited on progress, and helps them not sort of move on to the next project, the next priority. It will be very helpful for you to keep that research alive for the system. Generate implementable output. So think about your research question, your methods and your expected output. You won't be able to implement theory. So what is it? What are you going to implement? What's your output? And think about developing practical and accessible toolkits, blueprints, frameworks, key messages, videos. Think about expected impact and how you're going to measure this. What will your research inform? Will it be local services? Will it be workforce, the system, policy? Is it cost effective? Have you included health and social care economics? And how will you measure impact? Plan your implementation requirements. And again, this is more than academic publication. How do you make the results and output accessible to a non-academic audience? This means plain English, key messages, practical, real-world implementation, where possible, co-design for accessibility. The shorter, the more impactful, the better for the system. So they don't have to go rummaging around trying to find the key messages that they need to be able to decide whether it's relevant and implement. Think about resource and cost. How much will implementation be and how will it be funded? Think about those requirements early in budget. So ensuring value in research along the NIHR have been trying to standardise the way we talk about dissemination and implementation. And they've categorised this into 3 key methods. So one is quite passive activities to make research findings available and accessible. So this is further than academic publication, but just quite a passive activity. And then more active dissemination. So this is spreading research findings to the target audience via determined channels and using planned strategies. And then there's knowledge mobilisation, so actively bringing stakeholders together to share, respond to, and act upon your findings. Now, you may not know at the beginning of your research study what yours will end up being, but you must consider all these elements and how you might try and disseminate the findings as they emerge. And we need to think about impact and measuring impact. And this goes beyond academic impact, beyond that publication, and it goes beyond the activities that you do to implement. This is demonstrated by changes in understanding and behaviours and interests, and changes in policy, priorities, processes, pathways, and recommendations. So the ARC KSS implementation strategy is designed to use people's stories to develop relevant research questions that address locally recognised needs. And by doing that, we'll improve our implementation of our research because they are meaningful to and embedded in the needs of our population. We engage actively with our system leaders and budget holders early to align priorities and need and engage those leaders in the work we produce. And we need to understand relevant research, studies, projects, innovative practice, existing models of care and their evidence base, what works and what good looks like locally, nationally and internationally. So we feedback and disseminate our findings to provide challenge and inform ARC research activities locally and nationally, and ensure our themes consider needs, opportunities, barriers and enablers at the earliest stages of research design. And ultimately, we hope by doing this, we will improve health and social care outcomes to the public through implementing and integrating research activity, outcomes and new models of care that are recognised, that improve quality and safety, that are evidence-based, reduce unwarranted variation, and are cost-effective and sustainable. So there's a number of tools and sciences you can reference and utilise. But my top tip is it's building key relationships, networking, understanding the system that you're working in and the variation that can be across systems, and to really remember language barriers. So there is a difference between academic language and health language and lay language, and we need to try and bridge that gap to make research and findings accessible. And engage, co-produce, work with your public and community members, work with people who are experts by experience, and build communities of practice. So finally, I just wanted to share some examples of accessible research output that have been designed for target audiences. These have been developed by ARC KSS researchers and implementation teams in the first 2 years of the ARC. And you'll be able to click on the links and see what's being produced. And just to say thank you. If you need any more information, please contact ARC KSS Building Capacity team or core team, and I'm sure they will put you in contact with the most appropriate person to support you. Thank you very much.